Syphilis is a serious health concern that has been affecting humans for centuries. Despite advances in medicine, it remains a significant issue today. It is a sexually transmitted infection, or STI, which means it is primarily spread through sexual contact. This makes awareness and education crucial in preventing its spread. This means it spreads through sexual contact, including vaginal, anal, and oral sex. It's important to practice safe sex to reduce the risk of transmission. The culprit behind this infection is a bacterium called Treponema pallidum. This spiral-shaped bacterium is highly adept at evading the immune system. This bacterium is highly contagious and can spread rapidly if not treated promptly. It can be passed from person to person even if symptoms are not present. It infects by entering your body through tiny cuts or abrasions in your skin or mucous membranes. This can happen during sexual activity or through direct contact with a syphilis sore. Syphilis is a sneaky infection. It can lie dormant in the body for years, causing no symptoms while still causing damage internally. It often disguises itself with symptoms that mimic other conditions, such as rashes, sores, and flu-like symptoms. This can lead to misdiagnosis and delayed treatment. This makes it difficult to diagnose, as doctors may not immediately suspect syphilis. Comprehensive testing is often required to confirm the infection. The infection progresses through different stages, each with its own set of symptoms. These stages include primary, secondary, latent, and tertiary syphilis. Each stage has unique symptoms, ranging from sores and rashes to severe neurological and cardiovascular problems in the later stages. Early detection of syphilis is crucial. The sooner it is diagnosed, the more effective the treatment will be, preventing long-term health issues. Treatment is most effective in the early stages. Antibiotics, particularly penicillin, are the standard treatment and can cure the infection if administered promptly. If left untreated, syphilis can lead to serious health complications. These complications can affect various organs and systems in the body. These complications include heart problems, neurological disorders, and even death. Therefore, awareness, early detection, and treatment are vital in combating this infection. The first stage of syphilis is called primary syphilis. It often starts silently, without any noticeable symptoms. This can make it difficult for individuals to realize they have been infected. A painless sore called a chancre marks this stage. The chancre is a critical indicator of primary syphilis, but because it is painless, it can easily go unnoticed. The chancre usually appears about 2 to 3 weeks after infection. This incubation period can vary, making it even more challenging to pinpoint the exact time of infection. It typically forms at the site where the bacteria entered the body. This could be any area that had direct contact with the infectious sore of another person. The chancre is usually firm, round, and painless. Its appearance can vary, but these characteristics are common. It can be easily overlooked, especially if it occurs inside the body. For instance, chancres can develop in areas that are not easily visible or accessible. Chancres in women, for example, often form inside the vagina or on the cervix. This makes it particularly challenging for women to detect the infection without a medical examination. This makes them difficult to detect. Many people may not realize they have syphilis until it progresses to a more advanced stage. Even without treatment, the chancre heals on its own within a few weeks. This self-healing can be misleading, as it might give the false impression that the infection has resolved. This might lead you to believe the infection is gone. However, the disappearance of the chancre does not mean the syphilis bacteria have been eradicated from the body. However, this is dangerously misleading. The bacteria remain in the body and continue to cause damage. Syphilis is still very much active in the body. Without proper treatment, it can progress to more severe stages, leading to serious health complications. It's silently progressing to the next stage. Early detection and treatment are crucial to prevent the disease from advancing and causing long-term health issues. About 2 to 10 weeks after the chancre appears, secondary syphilis emerges. This stage is characterized by a variety of symptoms. These symptoms can be mistaken for other common illnesses. This is why syphilis is often called the great imitator. The most common symptom of secondary syphilis is a rash. This rash is not itchy and can appear anywhere on the body. Other symptoms include fever, swollen lymph nodes, sore throat, muscle aches, and fatigue. Like the chancre in the primary stage, these symptoms may also disappear without treatment. This can create a false sense of security. However, the infection persists. It can remain dormant in the body for years. The syphilis rash is a hallmark of secondary syphilis. It can take on many forms, making it tricky to identify. Understanding its characteristics is crucial for early detection. The rash typically appears as rough, red or reddish-brown spots. It usually starts on the palms of the hands and soles of the feet, but it can spread to the entire body, including the face. Unlike many other rashes, the syphilis rash is generally not itchy. The rash might be accompanied by wart-like sores in the groin area or white patches in the mouth. It's important to remember that the rash can be very faint. You might not even notice it. Regular self-checks and awareness of any unusual skin changes are essential. After the secondary stage, syphilis enters a latent phase. This stage is characterized by the absence of visible symptoms. However, the infection remains active within the body. It can lie dormant for years, even decades. During this latent stage, syphilis is generally not contagious. However, pregnant women with latent syphilis can transmit the infection to their unborn babies. This can have serious consequences for the child's health. The latent stage of syphilis can last for many years. In some cases, it can last a lifetime. However, in about 1/3 of untreated cases, syphilis progresses to the tertiary stage. This is the most serious and potentially fatal stage. Tertiary syphilis is the most dangerous stage of the infection. It is a severe and advanced form of syphilis that can develop if the initial infection is left untreated. This stage is characterized by its ability to cause widespread damage throughout the body, affecting multiple organ systems, and leading to life-threatening complications. It can occur years or even decades after the initial infection. The long latency period often means that individuals may not even realize they are infected until significant damage has already been done. This delayed onset makes tertiary syphilis particularly insidious, as the symptoms can appear suddenly and with great severity. This stage can be life-threatening. The complications that arise from tertiary syphilis are not only severe but also diverse, affecting various parts of the body in different ways. The damage caused can be extensive and irreversible, making early detection and treatment crucial. It can affect multiple organ systems in the body. The bacteria responsible for syphilis, Treponema pallidum, can invade and damage organs such as the heart, brain, nerves, eyes, and bones. Each of these systems can suffer significant harm, leading to a range of serious health issues. Tertiary syphilis can cause serious damage to the heart. This can manifest as syphilitic aortitis, an inflammation of the aorta, which can lead to aneurysms or other cardiovascular complications. The heart's ability to function properly can be severely compromised, increasing the risk of heart disease and other related conditions. Tertiary syphilis can cause serious damage to the brain. Neurosyphilis, as it is known, can lead to a range of neurological problems, including cognitive decline, personality changes, and even severe mental health issues. The brain's delicate structures can be irreparably harmed, affecting a person's ability to think, remember, and function normally. Tertiary syphilis can cause serious damage to the nerves. This can result in a condition known as tabes dorsalis, which affects the spinal cord and can lead to severe pain, coordination problems, and muscle weakness. The damage to the nervous system can be debilitating, impacting a person's mobility and quality of life. Tertiary syphilis can cause serious damage to the eyes. Ocular syphilis can lead to vision problems, including blindness. The infection can affect various parts of the eye, causing inflammation and damage that can result in permanent vision loss, if not treated promptly. Tertiary syphilis can cause serious damage to the bones. This can lead to a condition known as syphilitic osteitis, where the bones become inflamed and weakened. The structural integrity of the bones can be compromised, leading to fractures, deformities, and chronic pain. It can lead to heart disease. The cardiovascular complications of tertiary syphilis can be severe, increasing the risk of heart attacks, heart failure, and other life-threatening conditions. The damage to the heart and blood vessels can be extensive, requiring ongoing medical care and intervention. It can lead to stroke. The neurological damage caused by tertiary syphilis can increase the risk of stroke, a condition where the blood supply to the brain is interrupted. Strokes can have devastating effects, leading to paralysis, speech difficulties, and other long-term disabilities. It can lead to blindness. The damage to the eyes caused by tertiary syphilis can be severe and irreversible, resulting in complete vision loss. This can have a profound impact on a person's independence and quality of life, making early detection and treatment essential. It can lead to paralysis. The neurological damage can be so severe that it affects a person's ability to move and control their muscles. This can result in partial or complete paralysis, requiring extensive rehabilitation and support. It can lead to dementia. The cognitive decline associated with tertiary syphilis can be profound, leading to memory loss, confusion, and other symptoms of dementia. This can significantly impact a person's ability to live independently and maintain their quality of life. It can even lead to death. The complications of tertiary syphilis can be so severe that they result in fatal outcomes. The damage to vital organs and systems can be extensive, leading to life-threatening conditions that are difficult to treat. The complications of tertiary syphilis are severe and often irreversible. The damage caused by the infection can be extensive and permanent, affecting a person's health and quality of life in profound ways. Early detection and treatment are crucial to prevent these devastating outcomes. This highlights the critical importance of seeking early diagnosis and treatment for syphilis. By catching the infection in its early stages, it is possible to prevent the severe complications associated with tertiary syphilis. Regular medical checkups, awareness, and prompt treatment are key to managing and overcoming this serious health threat. Diagnosing syphilis involves a combination of tests. Your doctor will first ask about your sexual history and symptoms. They will then perform a physical exam. This includes examining any sores or rashes. Blood tests are the most common way to confirm a syphilis diagnosis. These tests detect antibodies that your body produces to fight the infection. In some cases, your doctor might also collect a sample of fluid from a sore for testing. The good news is that syphilis is curable, especially in its early stages. The standard treatment for syphilis is penicillin. This antibiotic is highly effective in killing the bacteria. The dosage and duration of treatment depend on the stage and severity of the infection. Preventing syphilis starts with practicing safe sex. Using condoms correctly and consistently during sexual activity can significantly reduce your risk of contracting the infection. It's important to remember that condoms are not 100% effective, but they are the best barrier method we have. Knowing your sexual partner's status is also crucial. Open communication about sexual health and getting tested regularly can help prevent the spread of syphilis. If you're sexually active, regular STI screenings are essential. Avoiding risky sexual practices such as having multiple partners or engaging in unprotected sex can significantly reduce your risk of contracting syphilis and other STIs. Syphilis is a serious infection, but it is treatable and preventable. Understanding the different stages of syphilis, recognizing the symptoms, and seeking prompt medical attention are crucial for effective management. Regular testing, practicing safe sex, and having open communication with your sexual partner are the cornerstones of syphilis prevention. If you suspect you may have been exposed to syphilis, consult your healthcare provider immediately. Remember, early detection and treatment are the best weapons against syphilis. Don't let fear or stigma prevent you from seeking the care you need.